All right, ladies and gentlemen, welcome to the Knirsch training. I was going to say Steve and Amy, but I don't see Amy on here, so we're getting Steve today, which is the let's be honest,
the lesser half of the two.
No. I was trying to decide whether I was going to go with lesser or more, but we'll just leave it there. So no, they've been doing some trainings for us on under 65 health insurance and doing a great job. Got a lot of great feedback. But so without further ado, I'll kick it over to Steve. Steve, take it away, buddy.
Awesome. Thank you. And we're recording this. This is recording.
Yes,
Perfect.
sir.
All right. Okay. So today we're going to talk about ACA and an ACA application. So we're going to run through an application all the way through. Dallas, I need control to share my screen. Or Maddie, whoever's there, please. There we go.
And now we know why we're missing Amy.
Yeah, that's right. Okay, so first thing. There we go. All right, so this is Health Sherpa. Health Sherpa is where we're going to quote and enroll all of our ACA business through. So when we're talking about that medical piece, right? So we've contacted the client. We've got the information. We have a feeling that this is a either no money or bad health situation, and they're going to need an ACA plan. And so we're going to go here so that we can secure that kind of a plan. And then we're going to run through an application just to show you what that looks like, how you go about getting the eligibility results, how to look at those and read those, and what all that stuff means. So the one thing that you have to, or that you'll need to know, is where the income falls. So if we're talking about somebody with income, we need to look at a federal poverty level chart. Now, this is a chart I just Googled. You can get this off of the healthcare.gov. You can get this in a lot of places, but I just Googled this and pulled this guy up. So what we're looking for here is from 100% to 400% of federal poverty level, how many in the household, and what their income level is. So if we're trying to determine, one, if they're going to get any help on the marketplace at all, and two, what kind of help they might get. So we've been dealing in our scenarios with a family of 4. So if we just go right over here to number in the household of 4, and we just run across here, we need to make 100% is 26.5. So you're going to need to make, closer to 30, 35 to 37, maybe 39, well, 150%, 39.750 for a family of 4 to get help. And then the help is relative as you go back up to 400%. So you can see it even at 106,000 on a family of 4, they're getting help. I can tell you that 150,000 and closer to 200,000, they're still getting some help. So then you need to determine with the client at some point on a family of 4, when is it not in their interest to go forward with an ACA application. So if there's one person that is sick, maybe you take the one person, or not healthy, you take the one person and you go there. If it's all about money, then everybody's going to go here. So you'll use this chart to get an idea if they fit in here. Now, let's just say 150% of federal poverty level. If they're below that, and they're a family of 4, will they get any help on the marketplace? Thumbs up, thumbs down. Anybody? I can't see too many people. I can see Robin. Robin, what do you think?
I'm sorry, say that one more time. My wife was sending me a message.
Okay, so if we have a family of four and they're less than 39,750 on the federal poverty level chart, do you think that they're going to get any help on the marketplace? Any subsidies?
Yes.
Okay, so maybe not, right? So there's a hole in the marketplace from Medicaid to 150% of federal poverty level. And if they make any amount of money in between there, they might make too much money to get Medicaid, and they may make too little money to get a marketplace plan. And so we have to take a look at that, and there are people that fall into that hole, and it's unfortunate, but sometimes you can't help them too much. Now sometimes they'll split the family up, right? The kids will go to Medicaid, the parents will be on the plan, but we'll take a look at some scenarios. But anything less than that 150% of federal poverty level, and they may or may not be getting any help on the marketplace. Okay. Any questions about this chart as of right now? We're good. We're going to move on. Okay. So let's take a look at, we'll just take a look at a zip code here where I am. All right, and so what we're going to do is we're going to start with zip code, then we're going to go with who's on the plan, right? So our scenario that we've been working on is husband, 40 years old, and we're going to add a spouse. (40 years old), kids. Something like that. Okay, so now we have our family of four. There's your four household members. If there's somebody else on the tax return that is not going to be on the plan, you can always hit this drop down box and add them. So if there's 4, 5, or 6 people on the federal tax return, but there's only 4 people applying, you can quote it that way. You just change the number up here. Okay, so there's a family of 4. And without doing anything over here on the right, this thing's going to stop spinning, and it's going to tell you that there's no savings applied, right? So they're not getting any help on the marketplace, and the plans are all listed down here below. So let's say we look at the federal poverty level chart, and this family is making $39,750. So at $39,750, mom and dad are eligible for a tax credit of $437, and the son and daughter are going to Missouri Health Net. This is in the state of Missouri. So they would both be going to Medicaid, the kids, and mom and dad stay on this plan, and they get $437 worth of help. And then all the numbers below have changed. So instead of $748, it's $311 with Oscar with this particular plan. There's 94 plans to choose from in this zip code from 6 different carriers. So if this family made $100,000, now they get a savings of $354, and all 4 of them are on the plan. And then the numbers change again. So instead of all 4 of them being on the plan at $1,216, it's $862 for that same Oscar plan. And you get the idea. We're just working up the federal poverty level chart here. Oops, that's a little too many zeros. So at 150, that doesn't seem right. So no help on 150,000 in the state of Missouri, it looks like. Okay, so let's go back to the 100K. So now we need to determine, and this is going to be a key that you're gonna ask these questions when you're in the prospecting phase of this. You're going to ask about doctors and meds, hospitals they want to go to, all that, right? And we want to be able to look at these plans and accurately determine what plan might be in their best interest. So if you go to this provider search right here, this is a CMS provider search. So this is all governed through CMS. And honestly, it's not correct most of the time. So what you want to do is, so if you put in doctors and hospitals here, so let's put in a hospital system, and then it'll tell you whether they take this hospital system or not, what carrier, and if they take it. Right, so obviously most of these so far on this first page say no, right? There we go. And you can put in doctors' names as well. So you can find doctors and add them to the list as well. And then they're either in or out of network as well, right? Now, like I said, this is not a very good search. It's not usually correct. So what we have to do is we have to go to the doc search at the carrier level. So you're going to find the plan that you're looking for, and you'll have to go through this until you figure out what carriers take what hospital systems in zip codes that you use a lot. And otherwise, if you're working out of your state and you don't know what that looks like, you're going to have to search the carrier websites to figure that out. So if we go down to Ambetter and we go to the doc search, should have picked a faster website. Okay. So you can search by hospital. And it'll pull up the hospital systems that this plan takes. So before, when we put in the search, it said that it did not take St. Luke's, and St. Luke's is so far not coming up here, but we can also put in the name search, and it'll likely not come up with one. Not come up in the search. So not in the search. So this is a plan that I would, if they wanted a St. Luke's health system, then I would not use this plan. But you do have to go here to search to be correct. So this is the right way, the correct way to do it in today's world. The CMS search and the carrier search don't always match. They're supposed to, they should, they haven't been. So unless something changes, right now you have to go to each carrier and confirm that those doctors and hospitals are in network with these particular carriers. Okay, same thing on the meds. You're going to go to the drug list with the carrier, and you're going to search the meds by tier level, basically. So you're going to put in the meds, and you're going to find out what how this carrier will work with those particular meds that your client has. And once you get through all of the list of meds and all the doctors, then you're going to come up with a list of carriers that will take this, that will be good for this client. And then you're going to use those carriers to quote and present. So obviously, when you rule them out, we're back here on Health Sherpa. What I will typically do is I'll just go down and check these boxes. So I have all the carriers checked and selected, and then I will just go through and I'll eliminate them. So I'm going to go through, I'll search Aetna. If Aetna is not a good carrier, I uncheck Aetna, right? I know Oscar doesn't take St. Luke's here in this area, and Ambetter we looked up, they don't. And so I'm going to come down to the carriers that that take St. Luke's, right? And then once I have those carriers, now I'm going to have I'm going to have 24 plans by 3 carriers or 2 carriers. Okay. And then the cost of the plans is the cost of the plans, right? So right now, this family of 4 making $100,000 worth of income gets $354 worth of help. And that's all reflected in the monthly premium. And now we go select plans. And the other thing we want to be careful of is network. So Blue Cross has a select network. Blue Cross also has a preferred network. Well, here's a Select Plus network. And then they have Preferred Care Blue in the Kansas City area. So we have to be very careful that we don't just select any old Blue Cross plan based on cost, that we make sure that we search the networks. Because when you go to the doctor search here on Blue Cross, you're going to have to put in the network. And you're going to make sure that if you select the smallest network first and you don't find what you're looking for, you go to the next one, and then you go to the next one. And then you know that you have to go to the least expensive Preferred Care Blue plan by Blue Cross to then get the doctors, pharmacies, formularies that you need for that particular client based on where they want to go and the meds that they take. Okay. So you will have to be careful. Some of these are just one network. Some of them have 2 or 3, and you'll just have to do your due diligence. Make sure you read through these. And when you see the network, right, like Blue Cross Select, and then you scroll down a little bit, you see Select Plus, you're like, oh, that's a different name. What's that all about? You're gonna have to go search those. And there's Preferred Care Blue, and then you'll get to know, if a carrier in your area has any kind of event leading up to the annual or the open enrollment period, then you're going to want to go and check those out. You're going to want to get the information from the carrier reps to then be proficient in what networks they have, what hospital systems they use, and a little bit about their plans, kind of like Medicare Advantage. You're going to want to know what their networks are, what the plans look like, what's most beneficial, any changes from last year to this year, that kind of stuff. So just some tips there on searching networks for doctors, hospitals, and for prescriptions. Okay, so let's say we've narrowed this down for this family of 4. And let's just say we're looking at a Blue Cross plan, right? So we'll get rid of Cigna. And then all of the Blue Cross plans, there's 11 of them. And the least expensive one is $1,075.81 for this family. It was $1,429.81. Remember, they're getting $354 worth of help. $8,700 deductible with $8,700 max out of pocket. Doctor's visits are free, no charge after deductible for specialists, and $50 on generic meds. Hallelujah. So the only thing we have going here is the premium compared to other plans. And that's it, right? So now we have an $8,700 exposure with $1,075 premium. And we need to make sure that we cover this exposure, at least for accidents, right? And probably for accidents and critical illness. And this plan is going to come out somewhere around $1,200. So if they have a budget that will absorb that, then we want to try to cover that as much as we can. Okay, and that does not include dental, vision, hearing, and all that other stuff. Okay, so let's say we're going with Blue Cross, and we're going to add, or we're going to this is the plan we want to do, or we want to get. So I would take this quote, I would put it into my CRM system, do my quote sheets, those quote sheets that we showed at main event, and it's got the option 1, option 2, option 3, and we would build a package based on this particular plan, or whatever plan that we feel is best for the client based on our conversation with the client. Everyone's going to say they want a low deductible. Well, that frequently does not exist on the marketplace unless they're getting a big fat subsidy, right? So the only thing they'd have to, we'd have to look at is if they made something like $50,000. And now they're going to get a bigger subsidy while the kids go to Medicaid. Let's see if 75 gets us what we want. Nope. So there's a little bit more help at 90, but anyway, we're going to need to work off of their household income, right? So this is adjusted gross. This is your adjusted gross income. So this is income minus alimony payments, IRA contributions, late withdrawal of savings, student loan interest. And that's about it. So it's their gross receipts minus those things. And that's what's going to make up this household income. And we'll see that when we go through the application here. Okay. So I use this in a quoting process. I take these numbers, I plug it into the CRM, I build my quote sheets and my packages, and then I'm ready to present to the client. Then I present to the client. Client says, hey, I like option 1. Option 1 is Blue Cross Choice Bronze 8,700, and we're ready to roll with that plan. I like the package, number 1 with accident, critical illness, dental, vision, hearing, whatever it is, and we go with that plan. So this is the medical piece of that package. And then what I do is I'm going to go back to the dashboard, and I'm going to say, Mr. and Mrs. Client, have you ever been on the marketplace before? And they're going to say, oh yeah, a couple years ago I was on there, but I never bought a plan. Or, yeah, we were on there last year, or whatever it is, right? They were either were, or they weren't, or they don't know. Sometimes they say, nope, never been there. And then you go open up and start an application, and there's an application there for them, right? So in this case, you're going to go up here to start an application. And then we're going to put in their information. So, and I'm using my daughter and son-in-law as examples here. Amy, are you on here, Amy?
I am.
What's Audra's birthday?
9/15 of 94.
Thank you. Okay, so we checked this box. We've received permission from the customer to work on their behalf. And then we hit search marketplace. And then down here, it's going to come up with if they've already had an application and what year the application was in, right? So there is already an application in the system, so it pops up here. If there's no application, then there will say that there's no results found, and then it'll give you create a new application button, and you're going to start a whole new application right there. Okay, so we're just going to hit apply here and open this up, and I'm going to walk through this as if I was talking to a client, and then I'll make fun of the places that I make fun of, and I'll walk through the places that skip through some of the stuff that we don't really need to address, and other stuff that we do. Okay, so what I look at, there's a lot of stuff to read here, right? There's a lot of stuff going on here. Basically, Mr. and Mrs. Client, what this thing says is before we can move on, we have to answer I agree and I understand to the statement. And we can read the statement in its entirety if you'd like. Basically, this is saying that by filling out this application, we are going to use, or the marketplace is going to use information from the IRS, Social Security, Department of Homeland Security to make sure that you are eligible for this plan and that you make the money that you make and you are who you are. Are you okay with that? Yes. And then we say, I agree and I understand. And we go to the next page. I'm like, congratulations, we made it. We're into the application. Okay. And then we're looking at filling out information if it's not already in here. Name, city, state, address, zip, birthday, socials. You need all of that information when we get to the application process. So we're going to go through all of that, make sure it's all correct. Okay, who's applying for coverage? Do you want to see if you get cost savings? So this is where if they are in need of a marketplace plan and they make significant money to not get help on the marketplace, then we're going to select no usually here. They're going to get a marketplace plan because I need it by physical need and not by dollars in their pocket. So we're going to go to no. But if they do want to try to get a subsidy, then we're going to say yes. Then we fill out who else is on the plan, all the kids and the spouse. We go to the next page. Okay, and then it wants to put who all these people are to everybody. So we have to draw connections and lines from parents to children and children to children and children to parents and all that stuff. We have to say who all these people belong to. Is this the address that everybody lives at? Yes. If not, then we put in a secondary address. Okay, now, unless you want to go to jail, Mr. and Mrs. Client, do you plan on filing a federal tax return for 2022? In this case, maybe 2023 even, when we get to open enrollment. Usually they're going to chuckle and say yes. And so, yes, and now it has to be a joint federal tax return with your spouse. That's how you're going to file? Yes. So it has to be that way. Are you or your spouse and your spouse claiming any dependents on your tax return? Yes. Who are they? And you check the boxes. Is there anyone else that's on your tax return? Check that box. Okay, do you live with anyone else under the age of 19? That's anyone other than the people that are on your plan. Okay, and then we're going to put in socials and we're going to put in tobacco. So if they've had tobacco 4 more times in a week in the past 6 months, are you a US citizen? Obviously, that's typically the case unless they're speaking a different language or hard to understand, then you might want to ask it. But, you know, we would definitely want to make sure a US citizen. And then I say, Mr. and Mrs. Client, this is my favorite question on the application. So are you prepared for this? Are you currently incarcerated, detained, or jailed? And they always get a laugh or a chuckle out of it. And I say, you know, I have yet to get a call from prison and somebody asking me to help them with health insurance, but you know what? I don't know if that could possibly happen. Are you American Indian or Alaska Native? No. Hispanic, Latino, or Spanish origin? No. And then you have to answer at least one of these. So ethnicity and race. So you have to go through and find out if they're white or if they're a combination. It'll keep adding things to that. So I think this thing says check all that apply. It used to say check all that apply. So if you're black and white or Indian and white or whatever it is, then you just keep filling them out until you get the total race and ethnicity. And then it's going to ask that same series of questions for each member on the plan. And you have to, some of these, it's kind of aggravating. Some of these, like, I can understand maybe they smoked before and then they don't smoke now, or they do and they don't, they did, don't, they did, I don't know. But race and ethnicity don't really change, do they? I mean, once you're born with that race and ethnicity. So I don't know why this doesn't keep pre-populated, but it doesn't. So you have to go back in and put these back in there. Naturalized or derived citizen. And then we keep moving down all of the members of the household. Okay, then you put in income information. So when you put in income information, you're going to select what type of income. Do they get it from a job, self-employment, unemployment, alimony, social security, some kind of retirement or pension? How do they get income? Other, fishing or gaming, farming or fishing, prize gambling, whatever it might be, right? So you got to put in how they get their income, and it might be more than one source. So let's say they get it from a job, and their job is from, you know, XYZ widget company, and their phone number, and how much do they make, right? So, whoops, another digit. Okay, how much do they make? And your selections are yearly, monthly, hourly, daily, weekly, every 2 weeks, twice a month, one time only. So if they're an hourly employee, I just ask them, are you an hourly employee? Yes. Okay, how much do you make? $17. And then how many hours a week? 40. And then that will calculate income, invalid area code. Okay, and then you'll save that. And then that'll add to their income. So now we have XYZ company at this amount, 40 hours a week at $17 an hour. Now this person's working 70 hours a week, so that's a lot of time. But you know, typically they're gonna have 1 or 2 jobs. If they're self-employed, they might have 2 or 3 different gigs that they have. It might just be one source, right? So you're gonna put that stuff in there. And now here's where you get your deductions. And if you just hover over this deductions guy, it tells you student loan interest, alimony payments, or other expenses like IRA contributions, executor expenses, or penalty on early withdrawal of savings. So it has to be one of those things. You know, other deductions are not just, you know, pets and whatever else, right? So usually it's student loan interest that comes up. And right now, you know, student loans have been kind of tabled as far as payments go. So people are typically not paying anything currently, but you just need to know the interest amount. So if they have student loan interest, they're going to need to go find their statement for their student loan, and they're going to need to know what the interest amount is only on that payment. So whatever the interest amount is. So you don't put the payment amount in there, you just put the interest amount. So you add a new deduction, student loan interest, and you put the interest amount and how often they pay it. And then that will calculate, it will take a little bit off of their income. So it'll deduct this amount from this total, and then you'll say, is this correct or not? Now, if they feel like, so if they know that they're going to be making more money than they made last year, right? So we'll go back up here and let's just remove this because that doesn't apply to this application. That was just for our purposes. And let's say it's 38,970, but they know that they're going to make 45,000 this year, or they feel like maybe they're going to make less. So is this what they're going to make in 2022? You can say no. And then is their income hard to predict? It's either yes or it is or no, right? So let's say it's yes, it's hard to predict. That's okay. Enter your best estimate of the expected yearly income for 2022. And then you put the number in there, right? So it's either more or less than 38,970, and you just put that number in there and then you move on to the next page. Now, if it's correct, you just leave it correct and you're done and you move on to the next page. So basically it's going to go from one member of the household to the next, to the next, to the next, and you're going to enter income, including for newborns and everybody else, right? They did take the smoking off of the kids, so, but the smoking question, but they still ask if they work. So let's say if that's correct, we go to the next page. Oops, what did I forget? Add one or more deductions, no deductions, there we go. Okay, and then the next income amount, put that in there. And then it's going to ask for the kids. Do the kids make any money? No. The next kid make any money? No. And the next one, no. Okay, so now we're on to the additional questions. So if you have somebody that you're gonna try to get a subsidy for, and you're going to be using this calculation from income, the application takes a little bit longer. You might have 3 or 4 people in the household that earn income and that are on the tax return together, and you might have to source and find all that information. So you're going to ask the questions, they're going to give you the answers, you plug it into the application. If it's just one household or breadwinner in the household, it's a little bit easier and quicker. And if you're going to the marketplace and you're not getting a subsidy at all, you don't answer any income questions and you blow right past that, and it's very short, 10-minute application. Okay, extra help. Do any of these people have a disability, mental health condition that limits their ability to attend school, work, attend school, or take care of their daily needs, right? It's an optional question, but if they do, then we say yes to whoever it is. No more activities of daily living, dressing, using the bathroom. And this is one that will come up at some point. Were any of these people found not eligible for Medicaid or Children's Health Insurance Program in the past 90 days? And this is a qualifying event. So if they were found not eligible, we can select the people who are found not eligible. And that will help us in getting a marketplace plan and a subsidy outside of open enrollment with a qualifying life event. Any of these people have Medicaid? Did any of these people have Medicaid or CHIP coverage that will end soon or recently ended because of the change in eligibility? If that's the case, we mark it, right? So getting kicked off of Medicaid, they get a rejection letter. That letter, then they hold on to that. They can email it to you. You check the members that were on Medicaid that are now getting bumped off. And then we will upload that letter at the end of the application so that the marketplace gets it, because they're going to ask for it in the end. We'll continue to the next page. And some of the stuff, if I already know that they're not on or never have been on Medicaid or CHIP, I just blow right past those and I don't even ask the questions. If I've done my due diligence up front and I know the answers, I will just go right past them and go to the next section that we need to talk about. Additional questions, existing coverage information. So they're asking questions because we're outside of open enrollment and they want to know if we have a qualifying life event. So are they currently enrolled in health coverage? Yes or no, right? Will their health coverage end on or before 8/6 of 2022? We either say yes or no. Okay, if no, they're not eligible for a subsidy. But if they are, then that's fine, right? So are they enrolled? Yes, yes. And this will get us to the end of the marketplace application and give us this will basically tell the marketplace that we're qualifying for a qualifying life event to then go and get this plan. HRA. So if they have an HRA, then we talk about it. If not, then we miss it. There's another HRA question. We blow right past that if they don't have one. Employer sponsored coverage. Well, this is another key that if you have employer sponsored coverage available to you, then they're not going to give you, you're not eligible for a subsidy on the marketplace because they're deeming that marketplace or that coverage at work is, quote, affordable, right? So the employer is going to pay usually 50% of the premium for the employee, and that's what they calculate that on. So I just saw a bunch of messages here. I want to make sure I didn't miss anything. Amy's answering that. Always decline to answer the ethnicity questions. Yep. Okay. Upcoming changes. Will anyone lose qualifying health coverage before August 6th of 2022? And if they are, then they're going to want to know when and who's it with. Although who's it with is optional. If there's an optional question, I'll usually skip past the optional questions almost all the time. One, it saves time in the application, and unless it's important information that they're going to ask questions about later, then we'll need to know. Well, we can skip it. But optional, I will almost always skip optional questions. Social security numbers. Sometimes you'll get somebody who doesn't know their kid's social security number, or they can't find their social security ID card or whatever, right? Or they don't want to give it to you. That's fine. You can continue on without it. But in the end, the marketplace is going to ask for it anyway. So I will typically tell people, I understand that you don't want to give your social security number to me, or you don't want to share that. However, the marketplace at the end of this is going to ask for documentation, and you're either going to give it to me or you're going to give it straight to the marketplace. So you're going to give it to somebody at some point. If we put it on here, then we won't have any problems, and we'll be done right now today. Otherwise, this is going to drag out until we get all that information to the marketplace. So typically they will divulge information and then we move on. Okay. Whoops. I'm just going to put this in here so we get eligibility results at the end that are going to show you kind of what this looks like. Okay, recent changes. Okay. More HRA stuff. Can't be in the future. Which one is this? Recent. Let's just leave that off. I have to put this in. It won't go without that, so. Uh, just using this as an example, so I just wanted to get through that to show you what the eligibility results look like. So again, you're going to finalize, you're going to review everything. So just go through, make sure that you've, all the information is correct. You've answered all the information correctly. And then we move on to the next set of statements. Now this is agree or disagree. And then we're going to sign and submit the application. So when we get to the end of this, what I will do is I will read these statements, and I'm just going to say, Mr. and Mrs. Client, I'm going to read these statements to you, and you're going to give me an I agree or disagree answer, and then I'm going to select that, and we're going to move on. So some of these I will give a little disclaimer because there's some caveats to some of these, and some of these we'll just read and we'll move on. So the first one is, to make it easier to determine my eligibility for help paying for coverage in future years, I allow the marketplace to use my income data, including information from tax returns for the next 5 years. The marketplace will send me a notice, let me make changes, I can opt out at any time. Now, before you answer that question, if you feel like this is something you're going to be on for the next 5 years, we agree and we move on to the next question. If this is something that I just need to go to the marketplace this year, a job change or something is going on and their income is going to be low for a certain period of time, then we can always say I disagree, and then we can put in here 1, 2, 3, or 4 years if we want to, or we just leave it I agree and we go for 5 years. The only reason I would give people this option is if somebody is a little leery of giving the government access, not like they don't have it anyway, but if they don't want to give access to their stuff for 5 years, then you can put in 1 year and move on to the next one, right? And you can take this year by year. Some people are very finicky about it. Some people don't care. They're just like, yeah, sure, I agree, no problem. And you move on. But I will at least give them the option and tell them that if you disagree with 5 years, you can put 1 or 2 or 3 if you want to. And sometimes they'll do that. Okay, then we read the tax attestations. So I'll read through these and answer the questions. So if they say no to any of these, then we're kind of dead in the water. This again is federal tax return information. They asked this 2 and 3 times on the application. And then this statement, I go over this and I caveat this one too. So I know I must tell the program I'm enrolled in if information listed on this application changes. I know I can make changes in my marketplace account by calling the marketplace center. Make changes in my marketplace account or by calling the marketplace call center at 1-800-318-2596. I know a change in my information could affect members of my household. I read through that almost that quickly, and no one ever asked me for that number again. But I say, listen, before you have to call the marketplace or go to your marketplace account, all you have to do is call me. I can make the changes through my account. You never have to call those guys on the marketplace. You never have to do that. One, that keeps them from getting confused on the marketplace. Two, that keeps the marketplace from changing your NPN number and you not getting credit for the sale. And three, it keeps control in my hands and not in the marketplace's hands, right? So if you give control to the marketplace, they will change your NPN number. If they do any work for anybody, they will change your NPN number. And then when you go back to your Health Sherpa account and you pull up this client, it'll say that it's not assigned to you or to a different NPN or no NPN at all. It's unassigned. So keep control over this as much as you can. Just tell people that you can upload information, you can make changes, you can call the marketplace with them, whatever it is, and keep control in your hands as much as you can. Next one, we're going through reading the question, and I agree or disagree. Most of this is, they're gonna stop your marketplace coverage, and they're gonna, if for some reason they find you eligible for Medicare, Medicaid, or CHIP, they're gonna stop your your marketplace coverage and your premium tax credit, so that you don't have to pay full cost or pay back your premium tax credit. So if you say I don't agree, so if somebody is going through cancer treatments or they're going through something and their subsidy goes away and they still need their health insurance, then you can select I don't give the marketplace permission, and they will not end anything but the premium tax credit. They will not end the plan. So if they're going through something crazy and they're like, I don't care how much it costs me, I'm keeping the plan, but I do want the tax credits, then you'll select I don't give the marketplace permission. Most of the time people are just on I agree and we move on. And then I always tell people this is the scary statement. I'm signing this application under penalty of perjury, which means I've provided true answers to all the questions to the best of my knowledge. I know I may be subject to penalties under federal law if I intentionally provide false information. Agree or disagree? Agree. Boom. Type the name in this electronic signature box and you hit continue. Okay. Now, when you hit continue, it's going to calculate your eligibility results. And let's see here. Before I submit that application, I'll just go back and I'll show you what that looks like. Okay, so there's everybody there. We're going to go down here. Hold on one second. This guy. Okay, we're going to go down here. So if any of the documents that these guys need, there's your 1095 tax document. So when they go do the taxes for premium tax credits, their notices are right here. And you can just download those and email them to them. They already have these on their email, but you can download these and get them to them if they don't receive them or can't find them or whatever it is. Eligibility results, that's why I wanted to go here. So your eligibility results are going to come up on the screen and it'll say download them. It'll download the eligibility results. You click on it. And then the marketplace, this is an older version. The new, it looks different on the new eligibility results. So it's a little bit different than this, but the premise is the same, right? So it's going to tell you who's on the who the household members are, and it's going to tell you if they get a premium tax credit or not. So this is what you're looking for right here, is choose a plan by this date and pay your first month's premium. And you want to make sure that there's a premium tax credit of whatever it is each month, right? And based on X amount of income for the year. So if those numbers are what you've been talking to them about, then we're in good shape. And I will tell you that if the quoting tool, if you put a number into the quoting tool of $50,000 and you put $50,000 on the marketplace application, it's going to come out within $1 of the premium from quoted to final. But what you'll find is you'll get into the application and they'll be like, okay, what sources of income do you have? And they would have told you that they make $50,000, but what they didn't tell you is they have several sources of income. Then they give you all the information, you plug it in, and it comes out to 52.5. And now 52.5 and 50,000 are very different. And now your premium tax credit is going to be different, and your premium is going to be different. So, you know, that does happen, and you have to recalculate premiums based on that if you're packaging stuff. Okay. And then if there's any requirements, you'll come down here and it'll say, it'll have a requirement. By this date, you need to supply us with a copy of your social security card, or a tax return, or a pay stub, or something to verify income, or something to verify you're losing coverage, something from Medicaid that says that you've been dropped from Medicaid, or you've been denied Medicaid. So whatever those letters are, whatever it is that they are requesting, then you will grab that information from here, and then you'll let them know, hey, by this date, we need to have these documents so that I can upload them into the system and get them to the marketplace. You don't have to call them, you don't have to mail them anywhere. You just give them to me, email them to me, and I'll plug them in. Okay. Then once you have the eligibility results, you're going to go to select the plan. And basically it's going to look exactly like the quoting sheet. So when we go back to the quoting tool here, maybe. There we go. So once we get back here, I'm just going to use this as an example. So we're not going to put all the same information back in there. Okay, so let's just say that this is the plan that it would look just like this when you get to after the application. You download the eligibility results, and then you're going to go to enrollment. It'll say a big blue button that says enroll in a plan. You click on that, and it's going to take you back to this page, and it's going to say, okay, this is that Blue Cross plan that you were talking about. It's $39.61, $8,700 deductible, 87 max out of pocket, free doctor's visits. Remember, that's the one we were talking about. Yes, okay. And then we're going to add to cart. You're going to add that to cart, and you're going to follow the rest of the steps through. It's going to ask you again about filing your tax return. It's going to ask you again about smoking. It's going to ask you again about a couple other things. And once you get to the end of it, it's going to have it's going to go to the carrier website to pay the first month's premium and set up recurring payments. And you're going to definitely want to do that. You want to at least secure the binder payment. If you do that for them, then they don't have anything to worry about. You've done all of your work for them. They don't have to worry about payment. Now, payment is going to come out as soon as this application goes through. So they're gonna see a draft from their account coming, almost immediately. So they want to make sure that you read the statements today. You're going to draft $39.61 from your account. And then on the date you selected, the first of every month, you know, they'll give you like the 15th through the 28th, or the last day of the month, or the 1st through the 28th and the last day of the month, whatever it is. And they'll give different choices for different carriers, and you'll select the recurring payments on whatever day they want. They say the 15th, boom, select the 15th, and recurring payments will come out on the 15th of every month. And once you've set that up, then they don't have to worry about payments, right? It'll give you a receipt. They will have a receipt emailed to them. If you want to hang on to a receipt, put it in your CRM system and save it, then you can do that. I would recommend that you make sure that that you save information like that, just for the sake of, you know, hey, you know, you said you made the payment for me and it never happened. Well, here's the receipt. I got the receipt right here. On this day, we paid X amount of dollars, and it didn't come out of your account for some other reason. So let's figure that out. Right. So just to make sure that you've got your backup. I pretty much save all documents and I put it in the CRM system under their name, and it's all saved there. But also it's all saved here too. Right. So all the documentation is all saved on Health Sherpa as well. So when it comes to eligibility results, the only thing it won't really save is your payment information. Like if you made a payment, you'll want to keep that. But most everything is down here. Anything that needs to be saved is usually down here. The information about the plan, the effective dates, the premiums, all the stuff, it's all right there. There's more eligibility results in 1095s. And then a little bit about the plan, who's on it, is terminated, blah, blah, blah. What? Okay. Once you've secured that for them and you've made the payments and everything else is done, then they're going to show up on the top of your list as, so we did this application today, right? So we just canceled the application. We didn't finish it. So they're on here for that reason, but we can get rid of it here, archive it, get rid of it. But if there's a requirement, it's going to have a little red exclamation point, right? So as of today, this guy still needs to pay his premium. Now, I helped him set up that premium and it's already done. I know it's done because I have the receipt. It usually takes a couple days, 2 or 3 days for Health Sherpa to get the information to the marketplace to contact the carrier to say, yep, everything's been paid, and it comes back and says it's paid. So I just come back here and I hit this, down here, it'll have a date, like as of this date. You just click that and it'll refresh it, right? So it'll refresh that and then it'll show that payment's been made. So tomorrow, the next day, I'll do that and it'll show that it's been made, and then I know that this guy's done and this one's done too, right? So these guys, they have requirements. So by the end of June, they need requirements. This one on the 12th, I'm waiting on requirements for this client. As soon as I get the requirements, I upload it into the system and it's done. Okay, any questions about Health Sherpa? I see there's a question in the chat. Oh, Robin had to go. He's got a 2 o'clock appointment. Okay, so any questions about running through the application, Health Sherpa, any of this stuff here? How to work with or handle clients? Questions to ask, not to ask? We're good? Okay. All right, so when I was talking about working with clients and keeping most of the control and for myself, I will definitely make sure that I three-way call the marketplace with the client. I'll call the client first. I'll just tell them to hold on. I'll three-way call in the marketplace, and then I'm going to direct the call. Sometimes the marketplace representative that you get is on top of things, and sometimes they're not on top of things. Sometimes you can barely understand them. Sometimes they're brand new and you can tell they're brand new. And if that's the case, and if I know where I'm going, I'm going to ask for a supervisor. And I'm going to ask for a supervisor until I find a supervisor that wants to talk to you. Some of these times they're on there, they've had a bad day, they've had a bad week, they're grumpy, they're grouchy, they don't want to work. So they don't want to help you. And I'll just say, hey, is there another supervisor? Can I talk to another supervisor, please? And then I'll get to another supervisor until somebody's, a little bit more joyous and friendly on the phone. And then we'll get down to business, right? I know exactly where I need to go. I need to get this accomplished. Can you help me do that? Can you escalate this to the next level so we get this done for this client ASAP? And just those little things, taking care of these people, just those little things will go a long way. And you can direct the client through that. Once you get on the phone with the marketplace, the first thing they're going to do is want to talk to the client. So, hey, Mr. or Mrs. Representative, this is Steve Knirsch. This is my NPN number. And I have my client on the phone with us. And we are trying to accomplish this. And then they're going to want to talk to the client. What's your address? What's your birthday? Confirm who they are. Is it okay that I talk to Steve about this? And they're going to say yes or no. And I'll prompt them before we even get on the phone. Just let them know, yes for this call, yes for this month, yes for this year, whatever you want. And if they say yes for the year, then they can call me and say, hey, will you find out from the marketplace, blah, 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 blah. And then I'll just call the marketplace for that client. It'll already be registered with the marketplace, and they will talk to me, and I can answer for the client based on their acknowledgement of me being involved. So if they'll acknowledge you for a month or a year, then you'll be able to contact the marketplace on their behalf, and you just contact the client. Hey, this is what you want to do. Yep, I'll call. I'll make it happen. And then you just jump on the phone and get it done. Once you have done that a few times, if you haven't done that yet, and you do that a few times, you'll know what I'm talking about. You just get right to the point and get in and out as fast as you can. Some of those guys are fairly with it, and some of them aren't. Let's just put it that way. And you want to make sure you get to the person that is going to be able to help you. Okay. Marketplace, Health Sherpa, marketplace application, selecting plans. The big things to remember are going to be doctors and hospitals, making sure that you go to the doc search for the carrier. CMS's search is incorrect in a lot of cases. Excuse me. So make sure that you search there, search meds there as well, and make sure that we're doing our due diligence. Otherwise, you're going to get caught, and you're going to recommend a plan for somebody, and they're going to go to their doctor, and the doctor's going to be like, we're not in network. And you're going to say, well, I did the search. I did it right there. There's the search. I did it. But if you don't go to the carrier search, then in today's world, it's not working. So you have to go to the carrier search, search the doctors, search the meds, and determine what plan might be the best for them. And then once you do that a few times in a zip code that you use regularly, you'll know what carrier takes what health system, and then you'll get an idea of how that's going to work. Okay, any questions? I went over that kind of quick. Has anyone been on the marketplace that have Health Sherpa, been on the marketplace? You've done this before? I know a few of you have, but some of you may not. Okay. All right. So if you have, you know what I'm talking about. If you haven't, then, we just basically ran through an application, and we ran through how to select the plan, how to quote the plan. And then the payment stuff we couldn't really see, but it's pretty self-explanatory once you select the plan and go through the rest of it. All right. Any other questions on ACA? Any other questions on calling the marketplace, dealing with the client, or Health Sherpa? I will show you. Let's take this person, for instance. So this is where it says verify income. So you click verify, And then you're going to select what type of verification they're providing. Is it a tax return, 1099, W-2, pay stub, whatever it is. And then we're going to say whatever it might be, right? Tax return, then they're going to email it to you, or they're going to bring it in and give it to you. They're going to mail it to you, whatever it is. And you're going to scan it and then upload it by selecting the file. So you're going to upload it here, and you're going to pull up the document, and then you're going to hit upload, and it's going to go to the marketplace. It's as simple as that. And you have to do it by the date shown. Okay. Upload history, it'll show here on this date, you uploaded these documents, and then it'll say down right below this at some point, whether they accepted the documents, it's pending, they're working on it, or they rejected them. We rejected this document, we don't want a tax return, we want a pay stub, or we want something else in addition to this. And then they'll ask for that, and you'll get that from the client, you'll upload that. Okay, so whatever the requirements are, we just want to meet them and get those out of the way so that the client keeps their plan and you keep them happy, and they keep paying their premiums. Keeps you happy. Okay. Is Amy still on here? Amy, do you have any questions or want to add anything to this? I don't know if she's still on. Questions in the chat. Can the network change during the year like MA? Yeah. Yeah, it can. Typically the marketplace, you'll know if something changes, but it can change. A doctor can drop out of the network. They can, drop the network at any point, and it's usually updated on a monthly basis or even more than that. But it can change, but typically it doesn't. Typically, you might find every once in a while somebody that has a problem, but we haven't run into that too much, at least in our area. Let's see. Anybody else? All right, well, that's all I have for the ACA and running through an application. If you guys have any other questions, I know that we've provided our contact information. Feel free to reach out to us at any point, and we'll be happy to answer any questions and help through anything. There have been many SIG agents that have come through and needed to write their first marketplace application or their 20th marketplace application, whatever it is, and they need help with anything. And we'll be more than happy to jump on and run through your first couple applications with you, do like a Zoom call, and we can be on and help walk through the application process. You can introduce us to the client, and we'll work through the first one or two with you, and then sit and watch you do the next couple, and then you're off to the races at that point. So if you need help, please reach out. We would be glad to help out at any point. All right, guys, that's all I've got, unless you have any more questions. And we'll see when we can do some more training. If you guys still need anything else, any more training, anything that you want to recommend to Dallas or to us, we'll be glad to jump on and do anything under 65 or group stuff at any point. All right, guys, thank you so much.
Steve and Amy,